Oh, welcome. It's really good to see you both. So today we are going to be talking about strengths-based approaches in ADHD. This is a topic that I feel super passionate about as an advanced nurse practitioner and a prescribing clinician as well. And I've been thinking a lot about how in the UK we're kind of seeing more of a neuroaffirmative approach to ADHD care. And so thinking about making the environment and the assessments that we are completing for individuals more strengths-based, more neuro-inclusive. And whilst we're not detracting from the challenges that people with ADHD experience, we're also trying to think of ways that actually, how can we boost self-esteem and actually really highlight the positivity that we see in difference. And Katie, I know that we've been kind of catching up about this, and you've got loads of experience with younger ones. Did you have any thoughts around this?
Yeah, I'm so excited to talk about this today because this is near and dear to my heart, both as a clinician. I'm a behavior analyst and worked primarily before I came to Qbtech in early intervention and school-based care. So I have quite a bit of thoughts about this. And now I'm also the parent of a twice exceptional child who has
Wow.
ADHD and also is academically quite gifted. So I've come from clinical work and experience in the schools to now living this at home. So it is something that I'm also very passionate about. And I think there's a couple of different things that come to mind to me when I think about strength-based approaches within the school system. As we all probably know, schools are not always the most friendly place for the neurodivergent brain, particularly in the US. The education standards are fast-paced, they're very structured. There's not a lot of wiggle room for teachers to make accommodations within the classroom for students. So often those types of environments are really challenging for students. And there's quite a few different approaches that can be taken within the classroom setting that can help students be really successful. And I think one thing I always love to keep in mind is the qualities that sometimes are labeled as bad or not good for school, or he can't focus, or she's impulsive, are often the qualities that lead to a really successful adult. You think about doctors in the ER, you are on your feet, you're moving constantly, things are always changing, it's fast paced. And I don't know about you, but I want my ER doctor to be able to move quickly and think about things very
Problem
creatively
solved.
and problem solve quickly and be more of that on their feet kind of person. And when we're thinking about kids in school, we really should be fostering those strengths for them to be successful later. So when we're thinking about school-based care, it's really about building resilience in the child, because we know that kids with ADHD, if we're not setting them up for success early on in life, it can lead to higher rates of anxiety, depression, more issues later for them. So if we can focus on building their skills within the schools and within their younger years to help them not only be successful in an environment that's not always geared best towards how their brain works, but also be really successful and able to hone those skills later in life. So a lot of the work that I was able to do in the schools, and I will give the caveat that often when people hear behavior analysis, they often are like, oh no, she's just here to extinguish behaviors, often the term that you hear, they just want bad behavior to stop. But really, behavior analysis over the last probably 10 years specifically, which is about how long I've been practicing, has really shifted its perspective. And it's part of what kept me going in the field towards positive skill building and looking at the skills that a child already has in their repertoire and building on them to help them grow. So when I would go into a classroom looking at a student, that was where I would start, is what are they like? What are they interested in? What gets their eyes to light up? What is it that this student is really excited about? And then using those types of skills to help build a plan for that student will help them be the most successful in their classroom. So some examples that might come to mind are a student who's really excited about math. This is my son in particular. Math is his thing. He and I do not see eye to eye when it comes to that. I've never been good at math, but that's his thing. Using something like a self-monitoring checklist for a student who's really great at math to help keep them on track during language arts, creating some kind of math puzzle that they can then check off, like, I've written 75 words on this article, or on this essay, things like that, to help bring in topics that are really exciting to them and that they might hyper focus on, and applying them to something that's not quite as exciting for their brains.
It's interesting you bring that in. So my background working in CAMS, so child adolescent mental health, but also pediatrics, you're really reminding me of one little boy that I worked with whose specialist interest was trains. So he had an ADHD and autism diagnosis, but really struggled with sequencing of tasks and knowing when to move on. So we built a train track along his desk and moved the train along with the platforms with the school tasks that he needed to do in the classroom setting. Is that the sort of thing you're kind of thinking about here, where you're using the interest of that young person to help motivate them towards what they're doing in a classroom setting?
Yes, I love that example. It's exactly the kinds of things that we want to be able to use in the classroom. And it's an accommodation that a teacher can add that's not going to take away from the curriculum. It's not going to take away from the standards that they're working towards, but it's bringing in something that's exciting for that student and also builds that positive self-talk of, I get to play with my trains. Or I had a similar student who he was in preschool, so he wasn't quite in school-based years. And he had AU and ADHD, wasn't able to effectively communicate his wants and needs, but he would talk about letters and numbers all day long. So to be able to teach him how to effectively communicate, I started working with Play-Doh, and I would start making letters out of the Play-Doh. And we were working on joint attention, which, is something that is often a struggle, and language building. And we used that activity to teach him to say, I want make letter A, and start to string sentences together, which then eventually generalize to, I want to go outside, or I want water, which for this kid is, highly functional, but we capitalize on his interests to build that. One thing I found, in thinking about all of this that I thought was really interesting is there's a study that was done in 2023 with a cohort of students where they looked at students with ADHD and non-ADHD students, and they wanted to look at self-image and how they perceived themselves. They wanted to look at resiliency and how they perceived their ability to be resilient, and then also how they felt that they were perceived at school. And one thing that was interesting that came out of this study was they found that the ADHD and non-ADHD students both felt that they had high levels of resilience and viewed themselves really positively. But when it came to school-based behavior, that was where the difference was. Kids with ADHD felt that they did more poorly at school than the students without ADHD. So the conclusion that these researchers came to is that teachers really should not view their ADHD and non-ADHD students all that differently, because the reality is they don't view themselves very differently, at least according to this study. And it was a smaller N, but I thought it was so interesting because that has been my experience as well. And so it's all the more important for us to look at building resilience with these students by teaching to their strengths and using some more practical interventions that we can use to help leverage that. Technology is a huge one. Some kids just do really well with technology, and where we can incorporate that in our education goals, things like adding in choice. Where do you want to start? Would you rather start with your highly preferred and build some momentum and then go into the language arts homework that you're not excited about? Or should we eat the frog, so to say, which I've never understood that phrase, but eat the frog.
I don't think that's a UK phrase.
It's a very US phrase, and who wants to eat a frog? I don't know. But starting with the harder thing and then moving into the easier thing is kind of some reinforcement. I mean, building in, helping the student to navigate their environment really builds that personal resilience. So some of those more, practical things of the self-monitoring, helping to build positive relationships. There was quite a few kids that I would work with who loved to go see the school resource officer, the police officer who's on site at the campus, at the school. It's cool for a fourth grader to be like, I get to go see the police officer today. So I had kids that I would build that in as that was their reward. That was and it built this positive self thought around this kid getting to go visit this person who felt really important to them, right? There's all of these different ways we can weave in interests to help kids be more successful in the school environment.
And just to kind of clarify, so in the UK, we have something called an EHCP, which is an education healthcare plan, which that could be for a young person in an education setting who has a physical health need, a mental health need, or social, emotional, mental health need. And it's recognizing that you need some more formal reviews, but may need some more scaffolding from some lower level to a higher level of intervention. And a lot of the role when you're working clinically, at least in the UK, and supporting these young people, is also thinking about interventions to, like you say, strengthen, scaffold, and build resilience. And I'm curious as well, because sometimes I think you're talking about young people feeling with ADHD, feeling like they're not doing as well at school. And we know from the research that on average, a child with ADHD will receive 9 times more criticism within their day than someone without ADHD. So there's a lot of internalization there as well. Anna's nodding, she's got a therapist head on as well. But so I'm just interested in not only thinking about kind of what we can create as adults supporting the child, but also if there's roles for like mentoring other students with your strengths. So you were saying your child being amazing at maths. I can imagine then having the opportunity to teach a peer, if that doesn't feel too stressful, might be really empowering to be like, hey, this is what I'm good at. Let me share this with you as well.
Yes, you're exactly right. And that's, in the US, we have IEP plans, which are highly structured goals for kids who might need some extra support. And then we have 504 plans, which are a little bit of a lower tier, but a lot of kids with ADHD might have a 504 plan. And then not most of the time, there's there's a frequent amount of time that there might be a behavior intervention type thing in place for that student, whether it's just from the teacher, whether it's from an external support staff at the school. And I do think building in goals like that or strategies like that, where the student can then feel almost like a role model to the rest of the peers in their class. Again, thinking about building resilience during the math period, I get to go help so-and-so teach, or I get to go to the kindergarten class and do their math centers with them. That's something that in the school system I worked in, they called them peer buddies. And kids from any class got to go and visit a lower class, or even some of the special education classes. Some of the gen ed kids will go in and help the kids learn. And that was always really beautiful to see, and also did wonders for building resilience and positive self-image and relationships. And that peer-to-peer communication is so powerful. I will say, if there's any parents who are listening and you have a kid who you're going through the IEP process, or you're in the working on a 504 plan with your providers and your education team, advocate for your student to have positive skill building goals. There's sometimes a tendency to focus on reducing negative behavior, or reducing the amount of times they call out in class, or will stay seated for X amount of time. Advocate for your child or for your patient or your client. If you're a medical professional helping navigate this process, advocate for there to be positive skill building goals in there. Focus on increasing appropriate behavior rather than decreasing negative behavior. Because like you said, Jess, kids are more likely to hear more corrections. I have often write into some of the plans that I've worked on it should be a 7-to-1 ratio. For every correction, there should be 7 positives that you say throughout the day to that student, because all they're going to remember is the negative. So we have to counteract that with this positive, with this reframing, this acknowledging where they're strong, acknowledging where they're doing really well. And building that into any sort of support plan that might be in place for a student is crucial to helping them be successful long term.
And I was doing some reading as well, and the kind of neuroaffirmative approach, at least in the UK, isn't just kind of fixed to a clinical setting. You can create neuroaffirmative classrooms. And Anna, I know you're kind of more specialized in adults, but when we're thinking about a classroom setting, we've got kids in the mix who are looking up to their teachers, the adults in the room. And so I'm really curious around, do we need to shift in mindset in order to bring strength into this setting as well to support children's resilience building? What would your views be on that?
Yeah, and I've had experience in my clinical background working across the lifespan, though my current focus is mostly on adult ADHD. I was able to witness records of IEPs that didn't really focus on any strengths at all. And these are from very young peers, and I'm working with someone who's 18. So I'm able
Mhm.
to see that historical information and make those connections as to why they're struggling with self-esteem, with some mood issues as an adult, and especially as they're transitioning from that childhood phase into adulthood. When you have ADHD, that's so challenging because things are way different. And your support system, oftentimes, when you leave that structured setting of your home, is kind of ripped away. So,
Mhm.
even if you're going off to college, and Jess, I know you work a lot in that transitional age as well. Those times are hard. And when you get through into adulthood, if you weren't recognized at a younger age as being different than your peers and having those struggles, and ADHD is the reason why, then sometimes that can result in even more mood concerns as you are an adult. And I think that that's kind of contributed to some of the increase in adult diagnoses that we've seen, is that adults are having issues coping with their lifestyle as they've transitioned from childhood to adult. And so they might seek out therapy and
Yeah.
thinking that, oh, this is depression or this is anxiety. And thanks to thorough assessments through clinicians, they might discover that actually this has been ADHD the whole time.
Yeah.
And if you have a great therapist that does work in a strengths-based approach, you can really fine-tune that treatment plan and find, where do you exceed? What skills do you think that you can use in areas where you struggle? And I think that's a big piece with the strength-based approach, is it's not negating that you struggle. It's
Mhm.
recognizing that you exceed in these areas, you're uniquely good at this particular skill. How can we use that skill to support you in areas that are more challenging? And I think that a reframe is a lot of what a strengths-based approach is reframing not just your experiences, but the language that we use. And Katie, I think you had touched on this earlier, like he struggles with attention
Mhm.
for long periods of time. Whoop, let's flip that around and say, actually, he's really good at focusing for short bursts.
Yeah.
So frequent breaks are really helpful for him.
Yeah.
I think
Love
it's
that.
that extends from childhood all the way into adulthood. When you're working in an environment for an employee, that's a great thing to consider when you are working with someone who has ADHD, and like, how can we make this person's skills shine through in their work? And that's going to benefit not just the employee and the employer, but every coworker that works with them.
Yeah, absolutely.
Absolutely. And I'm really curious because the US healthcare model is quite different from the UK. And we're seeing this really interesting shift in the UK where more GPs are specializing in ADHD care. So, right from the front door, from your primary care provider, whether you're a child or an adult, you may be able to get a good chunk of that assessment done earlier on in the process before seeing a specialist. But that's really new. But what we're kind of seeing at the moment is that we've got wait lists. People are needing to kind of go through their GP and then sit on a wait list for a specialist provider. And so I think that's where some of this thinking around being neurodivergent or neurodistinct and thinking about strengths is really beneficial early on, because if we are needing some time to wait until we are able to see a specialist clinician to consider a diagnosis, it's almost considering, okay, what could we be doing at those really early stages, and how do we give everyone the tools to think about this person from a strengths-based approach. And Kate, I think you mentioned that in the States, do you see a pediatrician early on? And just thinking about what Anna said, like, if you can find a great therapist as you get older and maybe kind of unpick some of those things. But it sounds like, is there an opportunity for early recognition in the States, do you think?
Yeah, it's a great question. Personally, I don't think we're quite there with ADHD yet. Autism, for sure. The pediatricians are much more aware of the need to get an earlier diagnosis with autism. I mean, we at our clinic, we would get kids like as early as 16 or 17 months old coming in for therapy. But with ADHD, I had a hesitation, or I had suspicions for a while that we might be walking that road. And it took quite a bit of advocacy on my end to end up with the referral for a diagnosis. And we did still, because of his age, my son's quite young when it comes to when pediatricians typically will say around age 7, we'll diagnose with ADHD. And being a clinician myself, I knew what to look for. I knew what we were experiencing at home. I really had to advocate to we did a full psychological evaluation with him because we were ruling out some other conditions. But I think it's moving in that direction, that there might be some more earlier identification. That's in the US, we have a group that we work with called the ADHD Expert Consortium. And one of the big goals that we have focused on with them is improving education for clinicians around ADHD, improve the screening for kids, because most pediatricians get a class or two on ADHD in their entire medical school training. They're just not, they don't focus on it as much. And that's to no fault of their own. It's just a lack of education around it. So I do think there's still a little bit of hesitancy around, well, he's too young, or we're not going to medicate, so let's just work on behavior. I will say, though, my son, before even he got diagnosed, our pediatrician did recommend therapy, even without a diagnosis, occupational therapy, play therapy, which is basically talk therapy for kids, which I didn't know much about, to be honest, before, but it has been integral for us. And it's also provided us as parents with some support to leverage his strengths to help us at the home level. So I do think there's more acknowledgement of the role that therapy can play for these young kids. It's helped to build his resilience too. I mean, I've seen him just really grow through his journey with his therapist. So I think we're getting there. Do I think we're there quite yet? No, but it's one of the goals that this group has been working on, is to help improve the education and also to just bring awareness. I mean, it was part of my experience in the school system that always really broke my heart, is the families that just weren't aware of the support that's out there, where to find people, how to get answers, how to get help. I mean, there's just such a need here in the US for improved education and materials to get in the hands of families. And there's a lot out there. It's just a matter of communicating it and pulling it together to, resources like CHAD here in the US and ADA are great community support, but not a lot of people know about them, and kind of getting that word out that there is community support for families. So I don't think we're there yet. I think we're moving in the right direction in terms of that care.
It's interesting. In the UK, we have independent government body set up called Sendiax. In some areas of the country, it's called Sendiax, but it's essentially independent advocacy for those with what we term as SEND, as special educational needs and disabilities. And they are purposefully separate from the education and healthcare settings. These are a great group of individuals that are in people's kind of counties or boroughs, and they are the expert source of advice around what rights your child or you have as a family if you have a young person with additional needs. But they can also link you in the UK, we have something called young carers, which, for example, if you have a sibling who's providing a lot of support to maybe their brother or sister who has neurodivergence, then they can also access support as well. So it's taking on more of that holistic model of care, and they're integral in terms of like plugging you into different providers. But I also wanted to pick up, you kind of briefly mentioned medication there as well, and I kind of whipped my prescribing hat on with that one, and just thinking about being in clinic with young people and teenagers, and getting their medication right for ADHD, and even having that discussion around whether or not medication is the right route or not, but considering, okay, what choice does this young person have here? What do they want from the medication? But also acknowledging that side effects do occur. And so what is it that they feel is an appropriate trade-off? And sometimes I think we can almost accidentally kind of put a lot of focus into, well, I'm prescribing this to this person, like it's their role to agree to it if they want and then take it. And we almost forget, like, what's the role of the rest of the network? And so kind of even once we move out of the school setting, if someone has or hasn't been quite scaffolded, and Anna, you mentioned earlier about that transitional time where you start going to like uni in the UK or like college in the US, and all of a sudden you're independent and you're on your own, and maybe you don't want to take your meds, or your like parents or carers aren't there to go, hey, have you remembered to take this today? Or you've missed an appointment, which can absolutely happen, or you're choosing to take a break from them, whatever it is. And some of the stuff that I was looking into, and I know from working with both young people and adults with ADHD, that can be that real key period as well, where if that kind of resilience and strength hasn't been built in earlier, and given that we know from a neurobiological perspective, our kind of neurological growth can be up to 2 years behind, sometimes further back. So you've got someone in the body of an 18-year-old, but in terms of possibly emotional maturity, cognitive maturity, they may be a couple of years behind their peers. And all of a sudden, you are thrown into having to cook, clean, get to your classes on time. Maybe you need to have a full-time job. And I guess what I was thinking about was levels of burnout once that scaffolding has been removed, and how or do we contribute to accidentally setting people up for failure by not working with people in that transitional period to go, okay, what tools do you have? Who do you need to find? Who's going to be your buddy when you get to college, when you get to uni, to kind of help with that structure and build that routine? Again, Anna, you're doing a lot of nodding. Have you got any thoughts or feelings around this kind of scenario?
I absolutely do. And, I think it applies to that transitional period, but, most of my work is working adults, people who are, in a family. So in that work, the ability to pull in the entire support system, so whether that's spouse, roommate, partner, what have you, having them on board is critical to ensure that somebody is able to achieve all that they can. So, when you think about creating a treatment plan, whether it's medication or otherwise, understanding from the get-go how that person's unique brain works is step one, in my opinion. Regardless of age, you need a thorough assessment to know where are their strengths, where are their challenges, what interests them, and then making sure that everybody in their support system is informed. So, does that person's roommate understand that actually dishes are really hard for this person to get through, but for some reason, vacuuming is their go-to chore. And so, dividing up household things across the whole house, whether it's roommates or it's somebody you're cohabitating with in a romantic way, and kids as well, once you have kids, and understanding who does what, not just focusing on, okay, well, you don't have to do this because it doesn't align with your skill set, but also like there are always going to be some things like paying your own bills that are important for that person to take care of themselves. So how can their community or support system help them through those things that are inevitable that they have to deal with, but how can we help them? So, I am engaged to someone who has undiagnosed ADHD. And his son also has it, and he is diagnosed. So our household is a little chaotic at times. And I know when the mail piles up, I can help with that. I can bring it to the kitchen table and say, let's go through this together. This is definitely junk. This is definitely junk. And then it just helps get through those things and doing it in bite-sized ways so that it's not overwhelming as well. I think I was listening to, I think it was an ADA webinar that recently came out around strengths and how chunking things is so helpful. And this is something, I've worked in the ADHD space for a long time, and I've lived in a household with ADHDers my entire life because my mom and my brother have it. And I didn't realize this was something that I was doing already. And when we work with the people that we live with, I've been breaking down things and supporting where it needs, just in a natural way. But if you haven't lived in a household like that your whole life, that might not be a natural skill that you've developed. And so that's where that understanding is so critical. So getting that thorough evaluation and informing everybody that is around you. So it could even be your best friends. That community is critical for ensuring that somebody is not just achieving goals, but is happy in doing it as well. And I think that's one of the things that a lot of ADHD experts will say, like, your community is critical. This is not something that you should do on your own. And bringing in as many people from your network as possible is so key. And I think that extends even into the workplace as well.
I agree.
Yeah.
I'd agree.
Yeah. Just to add to that, I listened recently to Penn Holderness give a talk. If you're familiar with him, he's kind of a big celebrity at this point in the US. He has ADHD, and he does some really fun content about ADHD on his YouTube and his Instagram. He actually quit his full-time job as a sportscaster to do this. And now he's written a book called ADHD is Awesome, but he was talking about his transition from living at home to college. And his mom was there with him when he was giving his talk, which was so sweet. And he pulled up a picture of her and he said, my mom was my executive function. And I made it through high school. He had found his strengths. He was in theater. He had really kind of gotten to where he was feeling really successful and positive, and then he went to college and he didn't have his mom, stopped taking his medication, and things kind of started to fall apart. So I think thinking about that transition to young adulthood and leaving the house, that's a story that I've heard frequently. I did great in high school, and then I went and lived on my own and the wheels came off, and I needed support, I needed structure. So I think there's two things that come to mind to me. One, on the parent side, it's easy to executive function for our kids. I mean, it's easy to be the one. I can remember vividly my mom constantly like, did you take your clothes upstairs? Did you take your clothes upstairs? Did you fold your clothes? I mean, just reminders and reminders and reminders. And for kids, it's necessary. But then as we start to parent young adults, how do we start to fade those skills to them so that they're not relying on us as parents to be their self-regulation, their self-monitoring, their executive functioning skills to get tests done, that they're able to start to do that on their own, even in their final years of high school before they graduate and go, out to the real world. And how do we let students know who are in university or college what resources are available for them there, whether it's a student counseling center, whether it's a peer support group, whether it's one of the things I was thinking, listening to the same webinar, Anna, with Ada, they talked about mirroring and working alongside someone. If studying is really challenging for you, sit with a friend and study. And if they're staying on task, most of the time, if they're still on task, you might try to stay on task more. You might be tempted to distract them and look at Instagram with them or whatever it might be. But having those types of supports built into your structure when you go into that young adult transition, whether it's in college or university, or if you're going straight into the workforce, I think allowing young people to know what is out there for them is an area that needs to grow. It feels very daunting, and the community can feel hard to navigate, I think, and finding that. And we know loneliness is really prevalent, especially in the US. The Surgeon General is literally on a book tour about loneliness in the US for all adults, and how much more so those who might feel that they're struggling or having a harder time navigate day-to-day life because of having to work harder at keeping things in order, or finding their things, or knowing where their keys are, or remembering that there was a dinner they were supposed to go to, and being on time, and all of those different things. I mean, how much more so could that contribute? So I think there's a need for us to help grow the supports that are available to young adults as they're transitioning into adulthood.
I think the clinical space is changing with that as well, because I know when I was in clinic and I was transitioning young people going to university, and we're writing care plans. But so in the UK, you tend to kind of move from child and adolescent services into adult services, or go off to uni around 18, generally speaking. But we start to begin those conversations from like as early as 14, but often around 16, thinking about like, okay, let's practice of, if you were in this appointment without your parent or carer here, what discussions would be having. But I do wonder if there is more of a role, especially as digital tech is evolving. I was at an event the other week, and like there's so much available to us now, but it's just keeping track. Like you can download a bunch of research papers and put it into a podcast if your processing of information is better from an audio perspective. We have got apps, and Katie, I can really like resonate with what you were saying. So to get through my master's, my friend would literally, I'd tell her the day that I was going to type part of my thesis. She would check in with me, and she would give me like, tell me 3 things that you want to get done in the next hour and a half, and how many breaks are you going to have. We would set those goals. We knew that that was the limit of kind of what I could work with, a 10-minute break in between. And at 90 minutes, she would check in, and she'd be like, it just by message, and be like, what have you done? Like, what can you show for this? And just having someone there to kind of help keep that accountability, or to kind of scaffold you a little bit, it's amazing. But there's apps to help us get organized. But even going to your university or college, like you say, knowing which tools are available. When I studied last, a lot of people had gone to the university around their learning or kind of neurodevelopmental needs, and had like audio equipment linked to their laptop, which transcribed. And there's a lot more support available now if people know how to ask, because having ADHD or another form of neurodivergence does not mean that you are not able. It just means accessing the information the right way in order to maximize your potential. And I think possibly historically there's been a little bit of a, okay, well, we can kind of get you to this point and you'll be average.
Yeah.
But we know from looking at cognitive assessments and all sorts that people with neurodevelopmental profiles often have spiky cognitive profiles. They can be excellent, like truly excellent in some aspects of their functioning, but others, you might need a buddy to go, okay, I'm great at this. Can you fill this gap for me? And I know we often do that in our kind of interpersonal relationships anyway. But going back to kind of what we mentioned a little bit earlier around those who are gifted and talented or twice exceptional, you hear a lot around when that scaffolding is removed, burnout can creep in, that sort of thing. And it was something I was taking a little look into, but I'm just curious if either of you know much about that area. Katie, you mentioned having a child yourself who is twice exceptional. How do we support these individuals who I think people assume, well, you're smart, so
Yeah.
you can just get on with it. And
Mhm.
then people fall into a gap where, yeah, I'm amazingly smart, but I
Yeah.
still need the scaffolding in
Yeah.
these areas.
Yeah, I think it's such an interesting topic and one that I'm still learning about myself because I had not heard the term twice exceptional until last year. But I listened, Ned Hollowell says something that I think is so insightful. He says having ADHD is like having a Ferrari brain with bicycle wheels. Strengthen the wheels and you'll have a champion. And I think for me, that was so enlightening because there's just an example. My son has one of those spiky cognitive profiles. He's really, really strong in visual spatial processing and those kinds of things. But when it comes to general processing speed, he's much lower than the average. So he's high in some areas and then low in others. So understanding that type of profile for a child or an adult is super important. And knowing that while they might appear that they can do really well with this one area, they are having to work so hard to bring this other area up to speed with the rest of their skills. And that is what leads to that burnout. Event coordinating, planning things, keeping yourself on task, being on time blindness is, we know, a huge struggle for people with ADHD. And so those folks who might have really strong gifts in other areas that allow them to manage this area that might be harder for them, they're just having to work that much harder. So being aware of that with the folks that are in our workplace or in our homes who might appear having it all together, that was something that we always were like, oh my gosh, he's so smart, but why can't he follow this instruction? Like, what is it about the way we're communicating with him that's just not landing? And it's eye-opening when you realize that he's just having to work that much harder. So keeping that in mind when we're working with the individuals in our life who might display that kind of profile and helping to support them. It goes back to what Anna was saying about dividing up tasks, and you're really good at this and I'm really good at this, so we're going to handle this together, or acknowledging and kind of building that self acceptance of you're really strong in this area, but you need support in this area, and let's help use this to grow this, strengthen those ranks so that you can be a champion and not burn out because you're having to self-regulate so much and you're having to mask and cope to keep up with the rest of your skills, if that makes sense. I think it's a huge contributor to burnout.
And I am also wondering how much we just need to normalize this in
Yeah.
day-to-day society anyway, and kind of get into that mindset of what do you need? Like Anna, you're talking about kind of supporting the strengths of your family members, but I imagine there are times when you needed that kind of additional support as well. And I was listening to a TEDx talk by Katie Friedman that she termed it "Finding My Gold," where it's kind of about losing that spark into like and not knowing about your needs or not being asked about them, and kind of ending up with this late onset. She was diagnosed with ADHD in her 40s, and it was only through that acceptance that she started to like reconnect with the things that brought her joy. And Anna, I know that you've kind of thought quite a lot around adult populations, late diagnosis, but even being able to access that kind of diagnostic pathway as well. And so I'm really interested to hear like what your views and thoughts are for this adult community.
Yeah, I think access is a huge piece, at least in the US, that is a major barrier for folks. And I think maybe this is a little bit of a bias. I do feel like it's harder for adults to access specialized care for ADHD. Folks who are using a strengths-based approach is, I think, more common to find when you're working with folks who are specialized in kids than adults. Though I do see a trend shifting. Again, that's for more specialty clinics. And so when you're thinking about somebody who lives in the middle of nowhere, where access to healthcare in general is sparse, access to specialized healthcare is non-existent. So in those regions, telehealth has been such a blessing to connect us to people who geographically we would have never been able to get to that office. So I think technology has been a blessing in that way, is increasing that access to specialized care. But there are scenarios where technology can't give access to people. So, usually those specialists are out of pocket costs or are, only accepting in the US, we require insurance to cover our healthcare services. And so sometimes they might only take a private payer. And so those who are on public health insurances like Medicaid and Medicare are often left with fewer resources. And so, at Qbtech, I have led an initiative around access. And so improving access to tools that enable more robust evaluations for nonprofit clinics that often serve the underserved populations and who would never otherwise be able to afford a thorough evaluation. And if you can't have a thorough evaluation to know how your brain works, how do you know what strengths that you're going to focus on as far as optimizing your outcomes? So, I think programs like that are an incredible resource for folks who don't have that access. And it's not a perfect solution, but I do think that there are some really great free resources out there within community networking with fellow ADHDers and also digital tools that are free. There is I think a wave, which I'm happy to see within the tech industry, of apps and things that are being designed to be more friendly to the ADHD brain, because when it is friendly to the ADHD brain, it's friendly to all of our brains.
Yeah.
And so I think that that's a really nice wave that I'm starting to see. And that's something that I incorporate in our household, because sometimes I'm not here to be that extra support for my beautiful ADHDers. And so, if I'm traveling for work, I need something to be there for when my folks are needing help. And so I think digital tools are great. We, with a lot of hesitancy, decided that the kiddo in our house did need a phone. And so, it's a blessing and a curse, but we've developed some great tips as far as technology and setting reminders and using good features within apps to help things. So a do not disturb feature while you're doing your homework is always really good, because otherwise it's really easy to pick up the phone and start playing that game that he loves. So I think there are some really great free tools out there. From a clinician's perspective, I would also advocate for all healthcare professionals, but especially ones that are working in rural areas or community health systems, to explore some strengths-based education. There are some great platforms out there that provide you with those education credits that you need every year anyway, but that are all about a strengths-based approach to ADHD. So I hope that that's coming. I am seeing more of it in the trend, but I also think I'm a little biased because I'm so focused on ADHD. So it's, in my opinion, it might look like there's a trend towards that. But I think, if you're a clinician watching this webinar, explore that. They're usually low cost and they get you those continuing education credits that you need. And it's a great way to, up level your skills and provide a resource for your community that literally does not exist otherwise.
Yeah. And I think that's such important. I think that healthcare in general is shifting towards empowering the person who is attending the clinic. At least I would hope so. And as clinicians ourselves, I know that my biggest tool is being able to listen and hear that person's perspective. And kind of considering that and everything that we've talked about today, I feel like possibly what's underlying all of this is the ability, whether you're an employer, whether or not you're an education provider, whether or not you are a healthcare provider, or if you're a partner, a parent, a carer, is about creating psychological safety and containment. So for someone to feel safe and contained enough with you to say, you know what, this is what I really need, or I feel like in this environment, I can really do this. But I would really like some support in order to do this. Or do you know anyone that can kind of help me to kind of buffer that? But I can imagine part of the barrier is if you're not feeling safe. So thinking conversely, if you're feeling scrutinized, or if going back to that kind of discussion around criticism, if, for example, a workplace isn't thinking about reasonable adjustments, or a classroom is just kind of focusing on what you can't do, that's going to kind of make you go more and more into yourself. And Anna, you mentioned earlier about the kind of benefit of having access to a good therapist who can unpick when a neurodivergence may be underneath other co-occurring needs. But I think we're coming back to that network and that community, your environment, and how that promotes and listens to you as someone with ADHD and empowers you to speak up. And both of you being in households, but also working for a company that's very focused on ADHD. You're both nodding and smiling, so I'm feeling like that aspect of psychological safety might be resonating. And yeah, again, curious on your thoughts. Do either of you have any views on that?
Yeah. I have two different thoughts. One from a professional perspective. I was actually just telling someone on Wednesday of this week about this student that I worked with who had ADHD and comorbid ODD, and he was very challenging. He had a very challenging home environment. He was a kindergartner, and I started working with him, and he was pegged quickly as the bad kid, the kid who destroys the classroom, or he can never get him to be calm, and he's just awful, and I don't want him in my room. And he was in a general education classroom. We worked for weeks on behavior supports, strategies to help keep him in that classroom. And the perspective on that student never changed. So the behavior only got worse. He kept escalating. We kept getting called over and over and over again for crisis intervention. And it was heartbreaking to watch because he was quickly pegged within a week, of being there. And within 2 months, he was moved out of that classroom. He was moved into, we call them specialized instruction classrooms that was geared towards kids with emotional behavioral disorders. The teacher immediately saw his strengths, knew what he needed to help get through the day. It was a smaller environment, which was very calming. It wasn't over. If you've been in a kindergarten classroom lately, it's a little much. I mean, I get overstimulated quick in those environments. And so it was no surprise to me that he went into this environment where the lights were low. It was, no overheads. There was calming music in the background. I mean, it was just the most serene. When we transitioned his care to that team, I never heard another word about the student's behavior. He did super well. He was engaged. He was completing his homework. Nothing else changed except for the perspective of the teacher and the gearing of the classroom towards his strengths. So I think that to me is some patients and students just grab your heart. And I will never forget working with him because it was incredible to see the value add that teacher brought when he just said, I know what he needs. I see what he's good at. We're going to use that and he's going to do fine. And sure enough, he did. So I think that he felt safe in that environment. He was able to be himself. He was able to get support where he needed it. And he was also able to leverage his strengths. He was very creative. He was very artistic. It was really fun to see just how he thrived. I think in a home environment, and this is something we're actively, walking and figuring out how to create safety. And it can be hard at home. I mean, I give a lot of grace to any parent out there who is dealing with a child at home who has areas where they really struggle. I mean, it is something that you're not often prepared for. I heard someone say recently, like, can my kid just be straightforward for once? And that's just not the case. A lot of the time it's not easy. But creating, I find personally, when we are focused on the positive and we're focused on praise and engagement, there's this kind of magical thing that happens when you can sit and have one-on-one engagement with your kid for 10 to 20 minutes and engage with them on something that they really like. Then when the demands come of, hey, we got to pick up your room, or we have to chunk this activity that you don't really like to do, but we're going to chunk it and we're going to do it together. Creating that environment where they feel that you're engaged with what they love you're spending time with them, you're honoring where they're having strengths, you're praising them for the good things that are happening, makes those times of challenge a lot easier to navigate as a parent and for the child. I just find that when we're focused on that, even in the times of frustration, we make it through and it's less frustrating and we're on the same page and we're working together. And, there's just this aspect of that with a parent-child relationship and also with the partner. When as your partner is, they're constantly criticizing you or like, oh, why did you, leave the laundry in the washer for more than 24 hours and it's not dried. Like when you're constantly met with this criticism, your inner talk can become really negative. But if you've got a partner who's like, hey, I noticed the laundry's still in the washer. Would you like me to help you with that? Yes, please. I hate doing laundry. There's just that slight pivot in the way you communicate and ask questions and offer support can make a huge difference for the overall feeling in a home and just help a person feel a lot more accepting of themselves in the areas where they might need support.
And Anna, do you have any thoughts around psychological safety in the home environment? You're very good at I can see that you've got some views.
Yeah, absolutely. The laundry one very much resonates with me. Our laundry is in our basement. And so if I don't see it, I miss it. And I don't have ADHD. And so when I think about things that maybe don't align with the strengths of my beautiful family, it's all about understanding that a difference in the way that we do a chore or that our lifestyles or the way that we think about things are very much explained by a difference in a brain and not by a lack of effort or not caring or anything like that. And it's so when I see something that, oh, I have to do this again, whoop, stop that negative self-talk as the person who is neurotypical. And I think that's so critical when you're working with the whole family to get everyone on board, is that it's not just we need to support the person that has the unique brain. It's also that we, as the person with the neurotypical brain, need to understand that we need to adjust our reactions. This is not a behavior that's intentional. It's just how their beautiful brain works. And it's also why when I'm struggling with a task that I just can't figure out, I need to pull in one of their brains because they're going to figure it out in 5 minutes. And I've spent 5 hours. So it's understanding not just how can I support them, but how they can support me, because there are things that brain are just so good at that I'm not good at. So yeah, I think that can be really empowering to people who have maybe had some negative self-esteem issues because they've been scolded throughout their childhood for behaviors, and also for the kid and empowering them in the household and understanding you need support, but I could use your support on this. So where can we all work together to help each other is so beautiful and brings in that sense of safety, and that if something goes wrong, it's really not the end of the world. If that bill doesn't get paid, you'll pay a little bit of an extra fee. That's what we call the ADHD tax. And it's okay. It's not a big deal. And so that's one thing that, as someone who tries to make everything perfect, I have to continually remind myself that this is not a big deal. It's fine. We can move forward. It's not the end of the world. And ensuring that I communicate that as well is important, and making sure that this is a safe space to both struggle and to shine.
I think that's a lovely place to kind of wind things up as well, because that applies not only to home environment, but also I'm really resonating with that with my kind of healthcare leadership hat on. And when I'm building a neuro-inclusive team and thinking about who I work with, we build on each other's strengths. We pair up to go, you know what? I'm great at starting tasks, but I could really do with someone that could help me finish this. So can we buddy up? Or I'm great at pushing things forward. but the details aren't quite my thing. Can I buddy up with you to kind of give me a hand on this? But also, whether you have neurodivergence in the workplace or not, I tend to find that checking in with what everyone's needs are, and do you need help, and bringing in vulnerability yourself, I guess, whether you're at home or in a different setting, and going, I'm not perfect here either. And what are my strengths? What do I bring to this? Um, what do I need to shift? But how can I support those around me to kind of maximize their potential and feel good in my presence, feel psychologically safe in this workplace, in this home, in this school environment? It's I feel like we're all agreeing to that sentiment as well. So I think I'm going to close it off here today, and Anna, I'll hand it over to you just to wrap up, if that's okay.
Yeah, I want to thank everybody for joining us in this discussion. I think it really shows that there's interest in pivoting the way that we manage ADHD care from a perspective of a clinician, but also in the community. So thank you all for joining us. I think we will have some resources in the notes for those who are looking to learn more about this. So I encourage you to check those out. And thank you again for joining.
Thank you.